Have you ever heard of the myth that intermittent fasting causes stomach ulcers? The answer is no, unless you do not eat properly when you break your fast. If you eat processed foods, acidic drinks, alcohol, high-fat foods, and hot spices to break your fast, the likelihood of stomach ulcers is high. There are several studies that disprove that intermittent fasting causes ulcers. The two most common causes of stomach ulcers are the H. pylori bacteria infection and overuse of non-steroidal anti-inflammatory drugs. These two causes together account for about 99% of the stomach ulcers. I am Annie, your friendly health coach. You can follow my health and well-being on all social media platforms. Now let's dive deeper into our topic today and learn more about the symptoms, the causes, and risk factors of stomach ulcers and how to prevent them. Let me briefly describe what stomach ulcers are. Stomach ulcers, also known as peptic ulcers, are open sores in the lining of your stomach or the upper part of your small intestine. The ulcer forms when stomach acid eats away at the mucus that protect the lining of your digestive tract. Peptic ulcers are any ulcers that affect both the stomach and small intestines. Let's take a look at the symptoms of stomach ulcers. The most common symptom of a stomach ulcer is burning stomach pain. Stomach acid aggravates the pain as does an empty stomach. The pain can often be relieved by eating certain foods that buffer stomach acid or by taking an acid-reducing medication. But then it can come back. The pain can be worse between meals and at night. People with peptic ulcers don't even have symptoms. Less often, ulcers may cause severe signs or symptoms such as vomiting or vomiting blood, which may appear red or black, dark blood in stools or stools that are black or tarry, feeling easily full, not wanting to eat because of pain, heartburn, acid reflux, chest pain, fatigue, bloated feeling, burping, lack of appetite or weight loss, nausea, anemia, pain that may improve when you eat, drink, or take antacids. Small ulcers may not cause any symptoms, but if you notice any of these signs, talk to your doctor. You will most likely feel a burning pain or discomfort between your belly button and breastbone. You might especially notice it on an empty stomach, such as between meals or at night. The pain may stop for a little while if you take an antacid, but it may return. The pain can last a few minutes or a few hours and may come and go for many days or weeks. In my introduction, I mentioned that intermittent fasting does not cause ulcers. Now let's look at the causes of stomach ulcers. H. pylori is a very common bacterial infection that affects up to half of people worldwide. It lives mainly in your stomach. For many people, it doesn't seem to cause any problems, but sometimes it proliferates and gets out of hand. If the bacteria continue to multiply, they eat into the stomach lining and cause chronic inflammation, leading to stomach ulcers. NSAIDs or non-steroidal anti-inflammatory drugs are common over-the-counter painkillers such as ibuprofen, naproxen, and aspirin. These drugs irritate the stomach lining on contact, and they also inhibit some of the chemicals that protect and repair it. Your stomach lining is designed to recover from these minor injuries. However, if you take too many non-steroidal anti-inflammatory drugs too often, eventually it won't be able to keep up with the repairs. The more the protective lining is worn down, the fewer resources it has to recover. Other less common causes of stomach ulcers include other infections. Rarely other bacterial, viral, or fungal infections can take over in your stomach and cause erosive gastritis. We also have Zollinger-Ellison syndrome. This is a rare condition that causes your stomach to produce too much gastric acid, which erodes the lining. Severe physiological stress. You may develop a stress ulcer if your body is struggling to recover from a life-threatening illness or injury. Severe physiological stress changes your pH balance, making your stomach more acidic. And your lifestyle promotes stomach ulcers. Normal lifestyle factors such as daily stress levels and what you eat and drink do not cause stomach ulcers, but they can make symptoms worse if you have one. Anything that increases the acidity of your stomach can irritate the soul. For example, smoking, alcohol, and spicy and acidic foods. Now, I'd like to give you some important tips on how to prevent a peptic ulcer. While stress and spicy foods can worsen the symptoms of a peptic ulcer, they don't seem to increase your chances of getting one, but a few other things can increase your risk. Number one, be careful if you take painkillers. Some people with arthritis or other conditions that cause chronic pain take non-steroidal anti-inflammatory drugs for weeks or months to relieve pain and swelling. These drugs can attack the mucus that protect the stomach from acid and increase the risk of stomach ulcers. These painkillers include aspirin, ibuprofen, and naproxen sodium. You are more likely to get an ulcer while taking one of these if you are over age 65, you are infected with H. pylori bacteria, you take more than one non-steroidal anti-inflammatory drugs at a time, you've had a peptic ulcer in the past, or you also take SSRI drugs to lower your chances for peptic ulcers while you take non-steroidal anti-inflammatory drugs. Use the lowest possible dose to control your symptoms and stop taking them as soon as you know you no longer need them. Take your medicine with food. Don't drink alcohol while you are taking these medicines. While taking non-steroidal anti-inflammatory drugs, you can take medicines that reduce the acid production of your stomach. Number two, do not smoke and drink very little alcohol. These two habits increase your chances of getting stomach ulcers. Both thin the lining that protects your stomach from acid, which leads to more acid. Ask your doctor to recommend a program to help you quit smoking and talk to him about how much alcohol you can drink. Number three, manage stress. Stress can make the symptoms of a stomach ulcer worse. Find out what is causing your problems and how you can deal with it better. Getting enough sleep, for example, can help. This can also strengthen your immune system. Number four, consider probiotics. Normally, millions of bacteria live in your gut. Some, like H. pylori, cause disease. Others are good for you because they help crowd out harmful bacteria. These helpful bacteria are called probiotics. In addition to taking the antibiotics and acid-blocking medications recommended by your doctor for your ulcer treatment, eating these foods may also be helpful against the ulcer-causing bacteria like cauliflower, cabbage, radishes, apples, blueberries, raspberries, blackberries, strawberries, cherries, bell peppers, carrots, broccoli, leafy greens such as kale and spinach, kefir, miso, sauerkraut, and kombucha, olive oil and other plant-based oil, honey, garlic, decaffeinated green tea, licorice, and turmeric. Number five, prevents an H. pylori infection. About 2/3 of people in the world have this type of infection, but most don't get ulcers because of it. Doctors don't know how you can avoid H. pylori, but they believe it spreads from person to person or through food or water. There are some things you can do to make infection less likely. Wash your hands frequently during the day with warm water and soap to avoid catching or spreading H. pylori bacteria. Wash your hands before eating and after using the toilet. Cook meat and other foods thoroughly. Only drink water you know is clean. It is no secret that the choices we make can have an impact on our health, so please take good care of yourself. I hope you will put into practice all the tips I have given you on preventing stomach ulcers. If you have any health concerns, please consult your doctor. If you have any questions or comments, please feel free to leave them below. Thank you and hey, bye.